Okay, welcome, Madeline. I am super excited to have you. Welcome to the Flawless Growth Podcast.
Thank you so much. I'm happy to be here.
Awesome. Okay, so let's start with this. Can you share a little bit more about yourself and also what inspired you to go into the healthcare and care management position?
Sure. I currently am working as a lead care manager for an organization called Malama Health.
Mhm.
My interest in the healthcare field came from a combination of personal experience, just with family, as well as an interest in mental health
Mhm.
and behavioral health. So I had some experience in those areas and was interested in doing a bit more direct client work, having patients of my own that I could support and that I could encourage. And I'm also a social worker, so I apply a lot of those tools and modalities into the work I do as a care manager. And I really enjoy being in the healthcare space in this role because I feel like there's opportunity for me to empower and advocate for my clients and
Mhm.
encourage them really to be able to advocate for themselves as well, for the resources they need, the care they need. And all of the clients I work with are on Medi-Cal. So that's a particularly interesting population because we're working with pregnant and postpartum Medi-Cal moms. And so these people are qualifying for services because of their pregnancy. And they're also qualifying for Medi-Cal, which means they're in a particular population that we call the birth equity population. So our goal with working with them is to improve birth outcomes, improve maternal health ratings, and just to overall improve the wellness of these clients. So it's a really special relationship I get to cultivate with them, and I really like what I do. And then, in addition to the care management part, I'm also a referral coordinator. So I am responsible for submitting the referrals to the health plan. If there are certain resources they need, like housing assistance or meal support, I'm kind of the middle person between them and their health plan. So it's a lot of my job is advocacy, and that's what I'm most passionate about. So I feel very grateful that that's what I get to do now.
Totally. And it's very awesome. So, from what I understood, you get a lot of kind of face to face, maybe contact with the direct client, which a lot of companies that have these issues sometimes that, let's say, their marketing or other teams that do a lot of things don't have direct contact with the end client and don't know a lot of the issues that they're having. Most of the people that know the issues are maybe the sales people, the customer support people, and there's sometimes not a lot of communication there. So it's super important for you to have that direct contact because right away you know what to do and you're getting direct, fast feedback from them.
Yeah, I feel like I get to hear the feedback like you
Mm-hmm.
mentioned, and I get to be a part of reporting that back to the
Mm-hmm.
health plans in hopes of making change.
Mm-hmm.
And even in the time that I've been doing this role, which is about a year now, I've seen changes happen as a
Nice.
result of things that we've reported and frequent patterns that we see.
Mm-hmm.
And that's really cool because it feels like, okay, we're able to accommodate to the needs of the people we're serving and specialize the resources within the health plan.
Exactly. You're moving the needle there, and there's nothing
Yeah.
more amazing than that.
Yeah.
Okay, and how did you end up in Malama Health? Like, what was your career path before Malama Health, and when did you start in Malama Health, and how did you end up there?
Yeah. So, like I mentioned, I was working in mental health
Mm-hmm.
before. So, I was working at a clinic, and it was a bit different than what I do now. I was in more of an administrative, um, managerial role there, just overseeing the staff,
Mm-hmm.
and overseeing the office. And like I mentioned, I was looking for more direct client care. That was what I wanted to get into. Um, and I was working at a private practice clinic. And I just noticed, like, okay, the population we're serving may absolutely need support, but I feel like we are serving the top 1 to 10% of
Mhm.
people. And it just didn't really sit right with me. I was like, if I'm going to be doing this kind of thing, I want to serve people who are in more urgent need of support. That just was where I saw myself and something I wanted to explore. So when I was looking for something new, I was really drawn to Malama's demographic that they serve. Um, I I really was interested in the fact that they were serving Medi-Cal clients, and I was just curious how that might be different than the private
Mhm.
sector that I had been working in, and it really is so different. I
Totally.
don't think I could have anticipated it, and I think the main difference is a level of gratitude that I see in this space because people are my main job is to tell people, "Oh yeah, you have access to this free resource." And they're
Mhm.
like, "What? That's so awesome. Thank you so so much."
Totally.
And or like within your health plan there's did you know about this and this and
Mhm.
like they're so excited to get these kinds of supports that they didn't even know they were worthy of.
Uh-huh.
Um, and so it's really special to feel like the gratitude from the clients immediately and to build those relationships. They really tend to lean on us a lot
Mhm.
and that allows us to empower them too. So I'm really grateful that I got into this. And when I came into the work, I hadn't had experience working with pregnant and postpartum members. So I hadn't had any experience in maternal health. And I thought that that might make it hard for me
Mhm.
to access them and to connect with them. But our company is really passionate about making sure that the care managers are well educated. And so they provide doula training to us,
Mhm.
and from there, I actually chose to also become a doula. So, in addition to being a care manager, I work on my own as a birth doula.
Oh
And that
wow.
really strengthens my ability to work with the clients that I see.
Uh-huh.
Um, so, yeah, that's kind of how I got into this.
Beautiful. I think yeah, that information part is very big because I know that happens a lot in any company or even like with, let's say, example, credit cards. I know that there's a lot of benefits that we have and a lot of people don't even know them or use them.
Yeah,
So super important for all the companies to be loud and share and create awareness about the benefits that exist, because a lot of the time also people can be um, struggling or they're mad because there's not enough help, but maybe there's just not enough information out there.
yeah,
So very
definitely.
amazing that you're able to tell them that they have all of these benefits and make them really happy about it. And
Yeah.
could you explain a little bit what being a birth, you said, doula, right?
Hmm.
What that is and how you do it apart from your job.
Yeah, so it actually is fairly related to my job
Hmm.
because a lot of it all surrounds supporting pregnancy. But as a birth doula, my main job is to provide emotional, physical support for the birthing person,
Hmm.
both prenatally, so before labor and delivery, and then during labor and delivery as well. Some doulas specialize in postpartum care. Focus after the labor and delivery, they come in to help with acclimating the baby, getting the family adjusted to these changes, and
Hmm.
providing some support at home. But I'm specifically for birth, so I
Hmm.
focus on the pregnancy part and then the birth as well. Um, and it's just, I mean, it's the most fulfilling work I've ever gotten to do
Yeah.
because you're a big part of this very significant, very vulnerable experience for these
Hmm.
people. And they're letting you in to that journey and leaning on you, asking questions, like you're facilitating some conversations. Um, and so that's a very special thing to be able to do.
Hmm.
And there's a few times that because Malama offers support in connecting our members to doulas, um, given that I'm a doula as well, I've gotten to work with some of my care management clients as
Mhm.
their doula as well.
Mm,
And so the relationship is super strong
of
because I'm
course.
able to support them in two different ways, but both under the same umbrella.
Mhm.
So that's built some really special connections too.
Absolutely. This is one of the happiest moments that a human being can have. So I'm sure you get a lot of that contagious energy from the moms.
Yeah. Well, and there's a lot of nervousness
Of
too. It's not
course.
all positive. So it's like, how do we balance all of
Uh,
those parts?
right.
Yeah.
And what does a typical day look like for you in as a lead care manager?
So the biggest parts of my job are client
Mhm.
contact and referrals. So when I'm talking with a client, we have a cadence of a biweekly check-in. So every one of my members I'll talk to at least every couple weeks to check in, say, hey, any updates on this thing that I shared with you? Or have you heard from this person? They said they were going to reach out to you. How are you doing? How's the baby? Do you need any other resources, etc.?
Mhm.
So that's a big part of my job, a lot of my day. We also do a lot of internal collaboration. So we have meetings where we're able to consult our clinicians on staff. So we have doctors, and we have a nurse, we have social workers on our team. And when there's like a case you don't really know how to handle, or you have questions, need additional resources, we're able to kind of like put our heads together and
Mhm.
say, "Oh, I know about this thing. Maybe you can share it with that person." Or, this is how I handled a similar situation. So I really appreciate having that. Um, and just constantly, our team is really trying to update and use what works and change what's not working. So it's very malleable, which is great. And then another big part of my job is the referrals. So I basically create the cases for members. I'm writing like, this is why the member is eligible or
Mhm.
is deemed worthy of these particular services. And I'm putting together those submissions for authorization
Mhm.
and then interfacing with the health plan on that side. So if it's missing information or they're having trouble getting a hold of the member once the member is approved, I'm that messenger, that link between the big people in the health plan and the individuals who are trying to understand
Mhm.
what all these programs are and what they have access to.
Understood. And how do you decide which person has access? What are like the eligibility requirements?
So it definitely depends, but let me try to think broadly about it. So just by being pregnant, that is one
Mhm.
qualifier that gets them the first level of eligibility. So now they're eligible for, if we're talking specifically about meals,
Mhm.
there's a program in Medi-Cal that gets medically tailored meals for members. And if you're pregnant, you can qualify,
Mhm.
but just being pregnant is not sufficient. You have to also have a high risk condition or a chronic condition because these meals aren't supposed to necessarily be for food assistance in the
Mhm.
same way that like EBT can provide food assistance.
Okay.
It's meant to also target, okay, you have this deficiency, or let's say you're anemic, have iron deficiency, or if you have gestational diabetes, something like that is required to make you eligible for the meals.
Mhm.
So we do the back end work of connecting with the client about what they know about their wellness
Mhm.
and then checking their patient profiles and things like that to see if there's anything else that we could add to their case. Um, and once they're deemed eligible, we can submit that authorization, and then the health plan will basically just confirm it.
Mhm.
And it's sort of a similar process for things like housing. Um, it just is more related to, okay, what is your current living situation? How urgent is it that you find new housing? Are you looking for assistance maintaining the place you have, or are you looking for somewhere new to live? So the metrics are a little bit different for each
For
type of
each.
authorization,
Mhm.
but the health plan does a pretty good job of laying it out. So as long as we make sure to get those questions answered by the member, then we're able to put together a solid case.
Mhm. Mhm. Got it. Understood. And for what would you say that makes Malama Health different? Like, for example, you mentioned some of these very unique um, benefits that it has, like food, or I think you also mentioned something about transportation. What other things? Because sometimes when you say like, "Oh, we're helping women who are pregnant with their health," you just think it's like health, like blood work or anything related to the birth itself, but you might not think it can go as wide as other as food, transportation,
Mhm.
etc.
Yeah. So, I mean, Malama is an example of what's called an ECM, Enhanced Care Management Provider. And this is a relatively new program offered under Medi Cal.
Okay.
And the goal of the program, the goal of all ECM programs, is essentially to provide extra support to demographics that are deemed either victim of inequity or needing extra kind of like support through whatever journey it is, because there's also because children can qualify for ECM, elderly can qualify, and it's the ECM support is intended to kind of be like a temporary handhold to get you the information you need to then be able to live a sustainable, healthy life.
Hmm.
So, specifically as it relates to pregnancy, that's a new journey for a lot of people. So, our job is to make sure that they have all the information in order to make informed choices about their health and about their pregnancy, all those things. So, I
Hmm.
guess what sets us apart from like a different clinic or something like that, because we aren't a clinic, we're not seeing patients, the doctors and everybody still do that,
Hmm.
but we are like a social work support, so helping them understand what they have available to them, and making sure they learn to utilize that
Hmm.
so that they have a better chance of long-term success, and not just trying to be a band-aid solution, a temporary
Hmm.
solution, but to, empower them to have more long-lasting health and achieve those goals related to their overall well-being.
Hmm. And what is the biggest source of clients for you? Is it referrals, or is it like doctors that talk about you? How do you know that you get most of the clients that talk to you?
Yeah, so most of them come to us through the health plan. They're
Hmm.
referred either by a doctor
Hmm.
or by the case managers. And then we also get inquiries from our marketing and social media and things like that.
Hmm.
The only challenge that sometimes arises there is sometimes they're not actually eligible for our program because there is requirements that you have a certain health plan or that you are within a certain racial or ethnic demographic. So when people come to us through the community, it's amazing. Like we want to be able to support them, but sometimes they don't qualify. So at least if they come through the health plan, we know that they're already
Right.
vetted and they're qualifying for what we offer.
Got it. Yeah. So it's easier to talk to them right away, and the other ones you have to do a little bit more of digging for them.
Yeah.
Hmm.
Mhm.
Okay. And can you share a story of something like success that you've had, or something that you remember a lot that stuck with you about a patient?
Yeah, sure. So I had let me think. So I had a client who came to us pretty late in her pregnancy. She was due like in a few weeks, and she was
Wow.
saying like, I would want a doula, and we were like, uh oh, it's hard to find a doula so last minute because usually a doula wants to do some prenatal visits and make sure you're set up for success when
Mhm.
labor comes.
Mhm.
And I had just finished my all my doula trainings. Pro- Basically just very recently became qualified to provide doula support,
Mhm.
and I was like, "We're not going to be able to find a doula in the
I'll do
community.
it.
I'll just be your doula."
Yeah.
And I met with the client, worked with her closely, and just built a nice, strong relationship so that when her labor did start, she felt like she could really lean on me. Um, And essentially, I supported her through birth. And when she had some complications after birth as well, I was a constant support for her.
Hmm.
Um, and then once she was kind of settled, she'd got her baby home, everything was good. We kind of shifted gears to focusing on finding her a job.
Hmm.
So she had been looking for work so that she could be able to obviously afford living in this area. Um, and so we worked together to build her resume, to help her apply to jobs. And we're still on that journey, but I think before we worked together, she had never made a resume.
Oh,
She had
wow.
never used Google Docs. And even though these are things that seem so simple to
Yeah.
us, being able to kind of guide her through that, give her these new tools, I think it was really special
It
to me
is. Yeah.
because she trusted me a
Hmm.
lot in order to help allow me into that, obviously to allow me into the pregnancy and birth journey, but then also like the job search and everything.
Hmm.
That's really vulnerable too. So
Absolutely.
I was just super grateful that we had such a strong rapport that we were able to just, get together on an afternoon and open up her laptop and figure out what qualifications she had, what jobs she was looking for, which I think really has set her up for more success going forward.
Absolutely. It's so beautiful what you guys do because it's the whole like the whole world that you work with to help moms be successful in
Yeah.
every aspect of their lives. So that is beautiful. And what you tell about being very vulnerable with Google Docs, that's 100% true. Like for example, like when I've helped my mom, she like you can see that they're vulnerable around it, they're scared about it. And it's so
Hmm.
simple for us, yes, but it's just very intimidating for them, so giving them
Yeah,
that power back, it's amazing.
definitely.
And maybe this was a great challenge that you've had, that this is a beautiful story. What other challenges do you see that happen a lot in the journey?
Um, you mean like working with this population?
Yes, that you see like a challenge that comes up a lot.
Yeah. I would say that the biggest challenge is affordable housing.
Okay, yeah.
We have a lot of cases where people are either struggling to pay their rent or they're living somewhere temporarily and
Mhm.
they're in need of finding somewhere new. Um, Maybe they need subsidized housing, and it's really hard in
Yeah.
this area because housing is very expensive and the vouchers for housing are very limited.
Mhm.
Just because you're eligible doesn't mean you get a voucher. There's a long wait list process and all of those things. And
Mhm.
it can be really disheartening because even in my role, I can't snap my fingers and solve the problem for them. I
Exactly.
can't say, like, oh, guaranteed, we'll get you housing, because that's not something anybody can guarantee here. So, helping them figure out kind of a plan B or something to do in the interim while they sort those things out, that's kind of where I come in. So connecting them either to short-term housing or helping them come up with a plan of, okay, for a couple weeks you might live with this family member, or who else could accommodate you.
Mhm.
If
Mhm.
just finances are a challenge, or there's not enough income, how can we help you find another job? Or just looking at the other variables instead of only expecting to find a new housing
Right.
unit that's going to be cheaper, something like that. So, housing is definitely the biggest challenge we see working with these lower income
Mhm.
pregnant women.
Mhm.
Um, and that I think is going to continue,
Yeah.
unfortunately, unless there's bigger policy changes. So, we really are trying to just make the most of the system as it exists,
Mhm.
get as
Mhm.
much information as possible so that we can serve our clients effectively and let them know what to expect. Because if we tell them up front, oh, you have access to housing assistance,
Mhm.
and we don't explain that,
Mhm.
then they might think, oh, great, I'm just going to be able to get free housing. Or,
Yeah.
oh, awesome, I'm eligible for a big check to come into me so that I can pay my housing every month. But it doesn't look like that. So we just want to let them know, okay, this is what that resource is. This is how it's going to be used. This is what the timeline kind of looks like. And from that lens too, approaching it with a trauma informed perspective. A lot of people that we work with have experienced some sort of trauma, whether it's around immigration or domestic violence or, whatever it might be. So helping them understand from the beginning what they can anticipate is going to make it easier for them to approach each thing as it comes.
Beautiful. Yeah, I think housing, of course, for this population is very limited and hard right now. But I think it's also an issue for everyone, like especially the youth. I think I've heard that for the first time, it's kind of like the first time that a generation is not doing better than their parents.
Mm.
And it's very tricky because a lot of young people, 20 to 30, are still maybe having to be in their parents' house because it's just very hard. It's just very expensive,
Mhm.
or either they just have to have a lot of roomies. So yes,
Mhm.
like we definitely need either policy change, or I've also heard that there's a lot of entrepreneurs trying to find a way to build more affordable housing. So let's hope that
Yeah.
in the future, something like a big change happens.
Yeah.
And that's also affecting actually birth rates, right? People are sometimes now scared to have kids
Yeah.
because they don't even have a
Mhm.
house. So
It's true. Yeah, birth rates are down.
exactly, exactly.
Yeah.
Okay, and what advice would you give to someone that wants to do something like you do, that wants to pursue a path in patient care management?
Hmm. It's a great question. I think my first piece of advice would be to explore a few different um, sectors, like to try maybe working with a few different demographics so you can decide who you can best serve. Because,
Mm-hmm.
like, for example, I love kids,
Mm-hmm.
but I pretty I pretty much figured out that that's not necessarily the demographic that I want to directly serve.
Okay.
And then there are plenty of people who love working with kids,
Mm-hmm.
love giving that type of support.
Mm-hmm.
And same thing with like my experience in mental health. Like that really taught me a lot about the type of work that I want to do, the type of patients I can support. So I would recommend trying a few different things.
Yeah.
Um, and I would also really recommend figuring out your personal boundaries
Mm-hmm.
because in a lot of this work, people are really leaning on you and you have to find a way to show up as a consistent support person, but not create some sort of
Oh
dependency.
yeah.
Because if they become dependent on you as soon as they're not eligible for the program, they're going to start to struggle again. And you want to really instead say, here are the tools for you to be able to do it yourself.
Mm-hmm.
I'm here if you need me, but I think you can do it. Um, and then also in terms of like work life balance, which is something people are talking about all the time.
Mm-hmm.
When you have a client in crisis, I've had clients who are actively homeless and they're about to give birth.
Oh my
And I've
goodness.
done everything I can to get their housing situated, to get all the information for them. And at the end of the day, when I have to clock out from my job, I no longer can really, provide much for this
Mm-hmm.
client. As long as I know I've done my 100% best to serve them, I have to also be able to leave that at the door
Yes.
and go on with the rest of my life. If I carry
Mm-hmm.
everybody's struggles on my own back, I'm going to burn out.
Yes.
So, we talk a lot about burnout in this field too. And I think the best way to avoid it is to make sure that you're setting those boundaries for yourself and making sure to still take care of yourself while providing that empathetic, compassionate
Mhm.
support to all of your clients.
100%. You're totally right there. Because you are as important. And if you're not taking those boundaries, you're not going to be able to deliver your best work. And absolutely it's so hard for you with because these are they can be emergencies, right? Not like let's say in my work like it's a report is wrong, something like that. It's just very different, right?
Hmm.
But super important like for people that do your job, or also for example for caregivers, they also have to take their space and take
Hmm.
care of their health.
Yeah.
100%. Okay, now I don't know if you know a little bit about the company's marketing. If you do, we can have some three quick questions. Okay,
About Malama's
about
marketing,
Malama's, correct.
I can try my best.
Okay. Okay, do you know if Malama's does any kind of digital marketing? And if so, what kind?
Yeah, so Malama does a lot of Instagram, Facebook, LinkedIn
Mm-hmm.
marketing, and we have a website
Mm-hmm.
that's pretty accessible and up to date. That's the primary digital marketing that we do.
Got it. Got it. And do you have any involvement with that marketing or not that much? You just know that they do it.
Yeah, I don't really do much of that.
Uh huh.
There are some in person marketing things we do, like tabling, that I
Okay.
participate in, but I'm not involved in the digital stuff.
Very cool.
So,
And for example, for those in person marketing that you do that you have experience with, is there any challenge that you guys have in this moment in regards to that?
huh. I would say, like, for example, if we are tabling at a clinic
Hmm.
where people are just trying to go to their appointment and go
Right.
home, it can be kind of challenging to interrupt
Uh-huh.
their day,
Mhm.
and say, "Hey, I have this free thing for you. Do you want to use it?"
Uh-huh.
Because a lot of people are suspicious of
A
that, to
hundred
be
percent.
honest. And the same thing with digital marketing too.
Yeah.
It's like, wait, what? No way, this is free.
Uh-huh.
Like
Uh-huh.
it doesn't. It feels kind of like a scam.
Yeah. Absolutely.
So I think the hardest thing about being in person is finding a way to educate and inform them, but without feeling like you're bombarding them with too much.
Uh-huh.
We've had some good success from it, but we also notice that it's just dependent on how much traffic is going through the clinic.
Hmm.
So yeah, I think we're still kind of getting a feel for that.
100%. And I think it's also about you have to be a little bit patient because right now I believe that the metrics is that you need to have around 7 touch points which with somebody for them to kind of trust you. So
Yes.
that you have to be very aware that the first two, three, 4 times they're gonna be like free. I don't. This might be a scam. Like, but at
Yeah.
least they saw the brand name and they saw a little bit of what you do, and then maybe at that 7 touch point, they're open to kind of learn more. And it's
Yeah.
something that unfortunately you have to deal with because, for example, these the timeshare industries and trips industries they've done a lot of that strategy like, oh, you have something free, but it's not true, like they're just trying to sell you something.
Yeah.
So people are very aware of that, and people have been scammed before. So it's just, yeah, preaching it, being patient, and continuing with the mission for sure.
Hmm.
Okay, Madeline, thank you so much for your insights. I love the conversation. Where can people learn more about you or about Malama Health?
Malama, you can go to heymalama.com. You can see all of the different offerings we have because, in addition to enhanced care management, we also have an app that you can
Nice.
use to track any, whether it's your glucose levels, whether it's your food or exercise. And there's some resources on there as well that are free. So, we definitely encourage people to check out the Malama app as well. If you're interested in getting connected with me, I can provide my email, which is just my first name at heymalama.com.
Perfect. Sounds good. Thank you so much.
You're welcome.
Uh,
Thank you.
Absolutely.